Hello, everyone. Every time we bring phenomenal guests on our show, today we have invited another special person, another futurist who has done some phenomenal work in his space. Anand is IIT Mumbai alum. He did masters in material science. He even pursued PhD from Purdue, and he has done some interesting and phenomenal work. And now he's in pharma. So let's talk to him and understand how a material scientist become a nanomedicine guy. Anand, welcome to our show.
Thanks, Sanjeev. Thanks for the invitation. I'm really excited to be here.
So, Anand, before we go deep dive into nanomedicine, let's talk about your life in IIT. Can you tell us a little bit about the hostel you were in, any interesting memory you have from the IIT days?
Yeah, yeah, of course. I think the memories I had from IIT days were some of the best memories. I was from Hostel 6, age 6,
Go Hostel
as
6.
very well known. So, and I remember the year that I was there. There's one of the T-shirts that they made. It's called Invincible, and they highlighted the V and the I for six. So anyway, yeah, very interesting time at IIT Bombay, and some of the things that comes to mind are all the interactions that we had with students and some of the student activities. The run to the Bihar Lake, and I was also part of the Head Six cricket team. So
Oh, wow.
I remember some of
So
the
you are a
good
cricketer.
inter-hostel tournaments that we've had. Yeah, it was such a phenomenal time. Although there are some rumors of tiger sighting, I haven't seen one personally, but those are some of the things that comes to my mind when I think of the hostel.
Yeah, I heard about that. Those stories are interesting, especially from the Hostel 4, by the way. I
Yeah,
have
do you
some
remember?
friends from H4.
Oh, that's great. There's a pipeline behind our hostels that we used to go and run. I think that's water supply going to the entire Mumbai from Bihar Lake, I believe. So I still remember someone taking me there in the first few months, and there is a phenomenal experience in looking, just seeing that place, and yeah. So some great memories.
Awesome. So, Anand, let's talk a little bit fast forward. You did masters in material science, then you pursued
That's
your
right.
PhD in material science. So technically, you're a material guru. How you transition into a pharma space? That sounds pretty interesting and intriguing to me. I'm sure our audience will love to know that.
Yeah. So it's interesting you say that. Pharma uses a lot of materials, and then if you think of most of the pharmaceutical things, whether it's the tablet dosage form or whether it's the injection, there is a lot of material science principles involved. Right from injection forces, how do you deal with viscosity? Because most of the injecting liquids are, other than something like insulin, most of them are viscous liquids. So there is injection, viscosity dealings, and even compression. When you make a tablet, you're compressing a lot of layers of materials.
Mhm.
But just to give you a background, like you said, material science. I studied material science, and one of the key aspects of material science, when people ask what is material science all about, it's about the relationship between structure and property. How do you look at the structure of a molecule or a material and then prescribe what kind of properties it can give? So once you understand the SAR in a structure property relationship, you call it, then you can really make materials of your choice, whether it's alloys, whether it's lightweight metals for the Air Force industry, or whether it is the toughest materials like silicon carbide for improved hardness, or you could look at things like polymers, ceramics, and other set of composites. They are pharmaceutically acceptable and useful for pharmacy applications. So when I studied material science at IIT Bombay, my focus was in polymer materials, and of course we had an excellent curriculum that talked about other materials like ceramics, composites, and the basic one-on-one of how the material properties are measured, characterized, attributed, and developed. So that was a fundamental, very fundamental learning that I've had from IIT Bombay. And one of the projects I worked with faculty was looking at the transport of ionic charges across polymeric membranes,
Hmm.
right? Today, there is battery cars. We talk so much about inverters, and we talk so much about battery applications. And in my opinion, IIT Bombay had some of the best faculties in understanding solid electrolytes. So I was working with my advisor, and we were trying to understand how these charges move through polymeric membranes. So the idea was to replace liquid electrolytes in the battery. Battery has three components, right? You have the anode, you have the cathode, and then you have a liquid electrolyte membrane in the battery. So in a solid electrolyte battery, the liquid is gone, and you're replacing that with a very thin layer of a conducting material, conducting polymer material, which conducts ions, not the electronic conducting
Right.
materials like copper. So that's what my thesis on. And then you need to understand that by spectroscopic methods, and many of our colleagues who are tuning in today can appreciate, there are AC impedance spectroscopy, AC impedance measurements, and you measure the transport properties of how these things move under a charge field from one end to the other. So
So
this is my,
this
go ahead,
is
sorry,
so
go ahead.
cool, Anand. But think about it, like 25 years ago, a young kid pursuing masters from IIT Bombay, and today you are the head of research at the pharma company AstraZeneca. You are leading today and helping humanity in a very, very unique aspect. Can, like, if you go back, can you think or can you even visualize you being here and doing such an impactful job?
Thank you for your kind words. Certainly, one of the most gratifying things working for a pharma company is that when you get up in the morning, you're always thinking about patients. How can I improve the lives of the patients?
Yeah.
Whether understanding, uh, I come back to this injection example. Let's say somebody is a chronic type 2 diabetes patient. How hard is for them to really do a daily injection before breakfast or after lunch, depending on the regimen they are in? How easy that material has to be, how the human factor aspects of that. So it's very gratifying. We can go into a little detail there, but it's very, very gratifying to be part of the pharma industry and being in the healthcare
Yeah, I
space.
get that, Anand, but the what really fascinates me, and I look at, and I'm so lucky to have and blessed to have amazing friends, and we talk about these futures problems beyond 2050, right? Like when we were in the college or when we were studying at IITs, we were not sure what are we going to be. I mean, every time we talked about you should have a clear vision, you should have a clear goal, you should have everything figured it out. But in reality, is life like that?
So,
It,
so I think,
it's very iterative, right?
yeah, you're absolutely right. Sometimes things do align, and when you study these things, you have no specific aim that okay, I'm going to do this and end up in there, right?
Yeah, I'll be the
Especially
vice president of AstraZeneca and I'm going to run the damn research there. I cannot even visualize sitting, I mean, 25 years ago, if you and me and having a cup of tea there, he said, really, Sanjeev, I'm not going to. That's too much.
yeah, so things do align sometimes, and I certainly believe that some of the fundamental things we learn back home in our schools and places like IIT are still I can use it today in our life,
100%.
believe it or not.
Yeah.
The structural property aspects, I try to apply that every single day in the choice of materials we choose. We'll come to nanomedicine in a minute. But the one of so I came to Purdue. I did my PhD. I was focusing on most of phase transitions and crystal growth and
Oh,
understanding
wow.
use of fluorophores to understand phase transition, high temperature phases. So it's a slightly different topic. But after working in the tech industry for a bit, one of the breaks I got in pharma industry that to Johnson Johnson, they were trying to. I mean, this is the connection. Okay, they were trying to drug delivery patches, right?
Yeah.
Lidocaine patch, pregnancy control patch. It's a skin patch. You have a little medication in the patch, and because of diffusion, the molecule just go from high concentration across the skin to the blood. But they were developing a patch which is basically they take a charged painkiller molecule, for example, fentanyl, which is a controlled substance, is an opioid. So you take a hydrochloride form of the fentanyl, and they want to apply a small current to the backside of the patch so that it pushes the drug inside the skin, just like you would do in a battery. So that was a correlation. So they want to understand the transport properties of the drug molecule in that skin membrane. Skin became the polymer. So this was quite relevant to what I did
You studied
back
in
in
IIT
place
days.
of IIT, where how do you measure the transport? How do you use impedance spectroscopy? How do you do DC conductivity? And how do you understand how this is transported? So essentially, we have to get molecules across the skin. The advantage is that instead of an injection, we're using a needle,
Yeah.
which is painful for many people. You just put a patch and apply a small current, and it pushes the drug into the body. And it's like an IV infusion. You turn off the current, drug stops. So he's replacing the whole IV infusion into a little patch with a small IC integrated circuit at the back.
Yeah, I
So
need
it's
that for
basically,
my hiking too, man. I'm dehydrated when I go there. Can I have it for magnesium and everything else I need?
yeah,
Electrolyte patch.
I think there is sports medicine uses this widely. It's interesting you say
Oh,
that. Sports medicine uses a lot of these
that'll
patches.
be so
Um,
cool. Actually, I'm going to stop you, Anand, for here. So, it's such a brilliant idea, and our alums are going to watch it. This is a brilliant idea. Imagine if we can replace every single injectable into a patch. Now you don't need, there is no
IV.
infection issue, there is no issues of weird problems we have. The waste we create with the injection, it's disposable. We have to throw the needle. How do you dispose of the needle? The patch replaces everything, makes it easy, and it saves so much time. I believe it's going to be, it can change the life of so many people, especially in remote places. What do you think about that, Anand? And as an
Yeah. So
opportunity for our alums.
yeah. So Sanjeev, is a great thought. You really hit the nail. But it is not that simple, okay? Because skin cannot really transport a lot of materials. Anything up to 500 daltons in molecular weight, it easily passes through the skin under even passive circumstances. You don't need a current. If you put, I think the what do you call that? Whether it's lidocaine for pain control or whether the motion sickness patches, these
Yeah,
are
that's the
all
one I use all the time because I have a huge problem, especially on the boat. When I was with you and Sandeep, I had the patch because I cannot
or
leave the
really.
boat.
See, I didn't even realize. It can be so much non what do you call? You
Invasive,
can
it
hide.
was discreet.
This is what people want. Thank you. This is what people don't want to take injection in front of other people. They want to do something as discreet like a patch. But the thing is, only small molecular weight compounds can be pushed through the skin. When it comes to biologic, I mean, there is no insulin patch, right? Why? Because
Not yet.
insulin is 6,000 Dalton. It is difficult to put something 6,000 Dalton across the skin, even under an electric field. So that's the reason why people have used some microneedle patches where there's microneedles. It's like sandpaper. It is not big needle, okay? Sandpaper, but they just apply it using a small applicator, and the microneedles are coated with insulins or other peptides, whether it's parathyroid hormone or salmon calcitonin for osteoporosis. You can actually put those high molecular weight, coat them on the needle, and then you can put them as a patch with a little injection, like a little force,
It's
so that it
almost
still
like an
gets.
injection, a
Yeah,
micro
but
injection,
whereas
I will say.
yeah, in fact, you don't even call it an injection. It's called a semi invasive patch, right? So a couple of things as you mentioned about alumni watching this, scaling this is a challenge. People can folks can make pills and capsules and tablets very easily because it's time tested. But when it comes to patches like this, you always there's a cost of goods. We call it COGS. COGS issue is a play, and there is some value to the patient that we have to bring forward, right? Replacing an oral pill with a patch or an injection would be a very tough thing for people to change because hey, I'm okay. I'm just taking this pill and it's doing my job. Why do I have to spend extra dollars to get a patch or extra dollars to get an injection? So we need to really find the type of diseases which can where we can use this technology. So anyway, that was my so a lot of material
So
science
hold your
associated with all
thought,
this.
Anand, for a sec here. I'm always trying, and the show is about inspiring our alums to start new companies and solve new problems. Right? So I clearly, and I'm just brainstorming with you and sharing with you. Like my daughter, she hates taking pills. She can't take a pill of anything. So I have to even crush the pill for her if doctor prescribe her the pill. Can you believe that? And put the capsules into some juice and do it. So there are a lot of people like her or people who can't take it orally for whatever reason because they're passed out or there are some other issues. I do see if somehow we can, and if we look at the band-aid is cheap, so its tape is not
Yeah.
the issue. It's just how do you put
Yeah.
that, how do you
It
put
is
it
the
together
electronics that
first?
go behind, right? If it's an electrically conducting activatable patch, it is the ICs. But even that, they're not very expensive, right? We have done
Exactly.
this for fentanyl. I was able to part of the team that launched the fentanyl patch. So anyway, before, can I just make one
No,
statement? I
no,
forgot to
please.
tell this at the beginning. Whatever I'm expressing here are my comments. This is not reflective of my companies or
Absolutely.
my past companies that I worked with. So these are not comments of AstraZeneca. I'm just sharing this my open views.
Yeah.
So I want
Now
to
we
put
will
that
include
disclaimer.
that as a disclaimer to Anand. This is absolutely, we are talking broadly how the industry is evolving. I mean, if you look back 25 years, we had nothing. In 25 years, we had made so much progress, even talking about mRNA, how we have leveraged mRNA technology and produced the vaccine in such a record time. It's unbelievable. We never
That's
thought.
nanomedicine. That's going to be the nanomedicine segue that we're going to make later in the call today.
Perfect. So let's talk about the nanomedicine. I know you are an expert and authority on nanomedicine. Please help our audience understand what it really means, because it's very complicated and people are talking about, oh, I take the nanomedicine and my cancer will be cured next day. What is really it means? How do you define this is a nanomedicine or this is a pill?
Yeah, so uh, nanomedicine is a broad term. Nanomedicine really refers to that branch of science that deal with nanoparticle technology.
Hmm?
So nanoparticles are small particles of the size of, you can all the way from 10 nanometers to 200 nanometers. According to the FDA definition, anything below 110 is nano.
Okay.
But there are things that are up to 200. We call it nanomedicine. So they're very tiny, tiny, tiny particles, right? So nanomedicine is that branch that really deals with particles of this nature. And what are these particles made of? That's what the material science aspect is going to come about, right? With are these particles made of uh, FDA accepted polymeric materials? We call it GRAS. GRAS is generally regarded as safe, GRAS. So whether it has to be a GRAS material. Anything you are using in humans, it has to be a GRAS material. If it is not a GRAS material, there are methodologies to get it acceptable for human use through a process, safety and tox studies that we can do. So nanoparticles have this unique advantage in that, let's say when you inject a biologic drug like Humira or any biologic, complex big monoclonal antibody, uh, they have long half-lives. That's actually good because once you inject, few folks don't have to take another medication for 6 to 8 weeks because it stays in the blood circulation for such a long time. 6 to 8 weeks is the half-life of it.
Wow,
Uh,
it's long.
yeah, so compared to a small molecule, let's say if you take Tylenol or if you take any other, small molecule drug,
Painkillers or
yeah, it's gone, right? That the painkiller is
next
gone.
day you need another one.
Yeah. So, and again, this is also very important when it comes to migraine pains, right? The onset of pain, the onset of drug is very important, right? If somebody is in deep migraine pain and if they're taking a pill and it's going to take them 1 hour to get an action to mitigate it's already too late, right? That's where sometimes when you give a bolus injection, it's in the bloodstream right away. And patches can do that too. Coming back to patches, I don't know why we never thought of patches, but today we're talking so much about patches.
Yeah.
When you have a microneedle patch, patches can immediately go into the bloodstream more faster than oral pill because you have to go through the first pass effect, go through the gastrointestinal tract. By the time you get into the bloodstream from oral is at least 35 to 40 minutes, 45 minutes.
Yeah, and
So
plus I will be using less medicine. I don't have to take so much of like 100 milligrams of something. Because if it's a patch, because I don't know how much of our body absorbs, because that's another thing. And then efficacy is also dependent on that how our body is absorbing it, right?
yeah, yeah. I mean, I think your knowledge about pharma is really really high because the terms like efficacy that you're using, in order to be a molecule to be efficacious, right? When you inject something,
Mhm.
there is a therapeutic window. Only think of it as a two broad
Yeah.
brand lines, right? When you inject something, it has to be within the therapeutic window to be efficacious. If it is below when you inject and if it clears out so quickly, if it doesn't reach that window, it is less efficacious. And if it goes above it, you get tox effects. We'll
Wow.
talk about tox effects because This is where sometimes, they say it's corrosive to the GI tract. Don't take it empty stomach because it's going to like go there. So sometimes, you want the dose to be exactly within the window most of the time. This is the big thing that pharmaceutics people work on. How do you get everything in that little window? Which is basically, we call it therapeutic index, TI, which is
Yeah,
the ratio of safety to tox.
got
So
it.
it has to be efficacious. You're right. So at low doses, sometimes things may not be efficacious. You need a higher dose. Sometimes patches cannot deliver higher dose because they're very thin. They cannot carry so much. And people don't want to pitch a big patch also. So
Of
anyway,
course.
the number of things that goes in. So coming back to nanomedicine, these are particles that are really, really small. When you inject them in the bloodstream, they behave very differently than a biologic or a small molecule. In that sometimes we call it pharmacokinetics or PK. When you look at the PK of a biologic, it goes up, and it has a large, long, half life. Sometimes nanoparticles just quickly go and come out, eliminate. So there are two things that differentiate nanomedicines. One is their PK, which is how they behave in blood. When you take a nanoparticle suspensions, like some of the vaccines that you are aware of right now in the market, making lipid nanoparticles containing a material like mRNA or anything. When you inject them, they have a certain profile in your blood. How much they stay, how much they come longer.
Right.
There are nanoparticles that we are developing. Some of them, we want them to have a hit and run profile. I mean, hit and run is a word that we use, right? Hit and run. So we want them to hit the tumor and immediately release, because we don't want them to hang there, because we don't want side effects of the medicine. So you don't want to have bystander killers or killing healthy cells. So
Healthy
we are
cell.
engineering particles that can quick to go, quick to get out. Simple. So those are like the quick. What I was telling you is the hit and run profile. So nanoparticles, you can engineer nanoparticles to behave in a certain way. This is all material science, right?
So that's
Typical.
fascinating, Anand. That's one question I really have for you is when I think of a nanoparticle, I feel like in my head is like a computer with a GPS and with the processor, and it is trained to do certain things, and it does that and it leaves. How do you even come up with an idea like that? Because it
So
almost feels like it's a damn computer in this small particle in my body,
yeah,
which is doing certain thing and is trained to do certain function in my body.
you said a very key word, and I was going to get to that in a minute. You said the word GPS, right? So I'm going to tell you in a minute how we are going to decorate the particles with the GPS. So when you take a particle, let's say, I'll give you some examples. The polymeric nanoparticles are very well known. Lipid-based systems are very well known. Of course, the vaccines are all lipid-based, right? The ones we came out in the last 2 years, LNP, lipid nanoparticles,
Yeah.
and there are polymeric nanoparticles, and there are some inorganic particles called silica nanoparticles and gold nanoparticles, and each of them have a unique biodistribution. Most of the particles, when you inject them, they go to the liver, right? So when 99.95% of the particle goes to the liver, it doesn't do anything. Let's say if somebody's tumor is in somewhere else, if it's breast cancer or prostate or something else, right? Or heme. Heme is like blood tumor. It's not even a solid tumor.
Yeah.
In those kind of things, so these particles, what they're doing is they carry the drug substance along with them. So we use our traditional chemistry to attach a drug, an oncologic drug, into the particle, so that when the particle travels, it's basically bringing the drug along with it. But if it goes all the way to the liver all the time, it's not going to do any good. It's more of talks than really efficacy, right? So that's why two aspects of nanomedicine differentiates itself from the rest. One is how do they behave in blood? How is their how is their distribution in the plasma of the blood? Number two is biodistribution. Biodistribution is the word we use. So we typically we put a fluorophore and we decorate the particle with the fluorophore and inject. You can literally tell in live imaging in rodents. It goes through in the bloodstream, then you can see it getting trapped in the liver. So, and if it goes to the spleen, sometimes there's a variety of, but mostly to the liver. But there are some particles, like there's a silicon nanoparticle that we are working with, that I'm used to. It's part of, it was discovered at Cornell. Uh, and The silicon nanoparticle, because of the size, it's about 5 to 8 nanometers. Because of the size, it's cut off for kidney filtration. So when you
Yeah.
inject this nanoparticle, it goes to the kidney, it comes to the urine, and in fact, there are published papers where they've taken these particles in the radio labeled attachment, and they inject, and it comes to the urine of the patients within in the first 2 hours. These are like quick to hit the target and excrete out. So the moment you change the biodistribution, so now it's no longer. So remember, we used to play this when we were small. We have little marbles, and there's a board with different numbers. I don't know if you recall. We used
Yeah.
to click the marble from one side,
Yeah.
and it will come through different slots. Right? You want to
Lots.
get in 300, but it goes to 10.
Right.
Right? Because
Right.
that's the path of least resistance.
Got
I
it.
always say this in my talk. Path of least resistance is liver. If things go to the liver, you never get it to your 300 mark. That's where you want to win the big bucks. So how do you, when you inject a nanomedicine, inject a nanoparticle, how do you take it away from going to the path of least resistance? And
Mhm.
that is playing with biodistribution of the particle. And this is all science, right?
Of
What
course.
kind of, yeah, it could be physical chemical properties of the materials, how elastic it is, how much charge it has, can it get caught by the proteins because the different size, are the protein corona shielding this particle? So where I'm going with this is the GPS. So we also, once we attach the molecule, we take a next step of attaching we call it ligand.
Okay.
It's either a big antibody or a small peptide. These are targeting ligands. They can say, okay, go. There are the receptors in the body, like for blood cancer, HER2 targeting. You can put a ligand that goes to the HER2 tissue. So by putting this targeting ligand, you have a GPS in a particle. So you have a small, tiny particle, you have a drug attached to it, and you have a GPS. Now, when you inject, it doesn't
And
go to
it's
the
all
liver.
in 3 nanometers.
Yeah, it's all no, it's less than everything would be less than 15 nanometers. If you
Wow.
talk of silicon nanoparticles, we can do all this three. We have published a paper in Nature where we show this the whole cross section of this particle and the dimensions and everything. Everything will be less than 15 nanometers. But if you take a larger particle to start with, is
Of course.
still going to be large. Like it could be 100, it could be 200, but the attachments still come within the conformation doesn't stick out so that it becomes really big. And we have zeta sizer, we call it. We do particle size after each step. So our scientists will go through the lab and they take the fresh particles. They do one, site surface chemistry. They measure it again. They put all the things that you want on the particle, and then they measure it again. You can measure the charge. We look at TEM to look at the image. So we have some. It's very interesting that you brought this topic because sometimes, depending on the particle is interacting with RNA or a DNA, it forms cylinders sometimes, it forms spheres sometimes, it forms stars sometimes. This is all
Wow.
nature.
Oh,
Yeah, this is
but
nature.
it has to
Yeah,
be something else. Like it has to be.
yeah, we are still in the stages of understanding that.
Okay.
These are, essentially, a lot of people have published this. Uh, because it's all charge driven, right? Sometimes you don't have to conjugate this little small molecule into a particle. You can encapsulate them. When I say encapsulate, you have electrostatic interaction between a negatively charged drug
Mhm.
and a particle that has a lot of positive charges built in it. So they come together naturally. And inside the endosome, uh, the pH is different, so it's able to open up and release the drug for endosomal escape.
Wow.
So so you need
That's
to really understand that,
fascinating. That is
yeah, physiology.
fascinating.
Human pH, you need to really know what is the pH of interstitial fluids, of bloods, acidic tumor, what is the pH of a tumor. These are all well documented, thankfully, right? People have really measured
Absolutely.
this.
Yeah.
So
Yeah.
once we know these little pH of different compartments, we literally do transport properties of these little particles throughout the different compartments, biodistribution studies, right? You do imaging, you see that yeah, it's going to this organ, it is not going to the liver, it's going here. But now different parts are lighting up because the particles are going to different organs. But here, when you put a targeting ligand, we have published in this paper again, it really penetrates deep into the tumor this is a HER2 model for breast cancer. You can
Wow.
see that with the GPS, it goes all the way inside. And one
That's
of our publications is
fascinating.
coming up.
I mean,
Yeah,
thinking
so
about it, like 25 years ago, you and me in the IIT sitting and doing something, and I look like, so really, we'll be talking about this in our lifetime. I mean, in this lifetime, we are going to change the way people uh, will be treated. So I have another bolt-on question to that. I understand now nano particle and how it works theoretically. Uh, so mRNA is pretty new to humanity. I know that a lot of research happening for last couple of decades, but really very new. And the first real drug came out of the mRNA is the vaccine for the COVID.
yeah.
Now, I was reading about it, and it seems like it's like a miracle procedure or miracle way of inventing the drug. We can bring the drug quickly, we can cure people quickly. So why can't we use mRNA for things like cancer? Because that's something is still a huge challenge for the humanity because we are not able to solve for, in most cases, the curing several kind of cancers. I know few we are able to, but majority of the cancers are still not treatable.
Yeah, so the class of materials that you're referring to, whether it's mRNA or all they come under the class of nucleic acids, right?
Mhm.
Nucleic acids, they're literally, they call it nucleic acids. So it could be messenger RNA, it could be siRNA, small interfering RNA, it could be DNA, right? So which is slightly different. So the
Right.
size is different. DNA is a double stranded, of course, we know that. And so most of these processes are nucleic, they happen inside the cell, right? So their function is very different compared to a small molecule drug. How I was explaining, when you inject a nanoparticle, it carries it to the cell surface, it takes the drug inside it and releases it. And it forms, free drug affects the tissues and you get efficacy. When it comes to nucleic acid, uh, we need to really understand uh, the delivery challenges of nucleic acid. These are big molecules compared to some of the small molecules. Nucleic acids are really big, and their job is essentially upregulation of a protein or downregulation of a protein. So it's basically fundamental mechanisms. Instead of how the small molecule reacts with the tumor antigens, this is very different. So you need to have strong delivery technologies that can deliver this RNA in the cytoplasm. In the case of mRNA, it is cytoplasm. In the case of DNA, it is the nucleus of the cell. So
Mhm.
these are very challenging areas, right? Getting and thanks to all the researchers in the last 2 years, what we saw with the pandemic,
It's phenomenal.
LNPs LNPs have emerged as a way, uh, fantastic way to LNPs can incorporate mRNAs and
Mhm.
they go inside the cell in the cytoplasm, and because of the pH change, it releases the mRNA inside the cells. It creates the proteins there
Mhm.
for the body to recognize, right?
Right.
So it is basically, again, we have done that for vaccination purposes. Vaccine applications are very different than therapeutic applications.
True.
In therapeutic applications, you need to have cure, you need to have, you're not proactively taking, I have something in my body, even if the virus comes, I'm good. But therapeutic action is very different, right? You need to have efficacy, right? So research is ongoing in whatever you ask the question. Uh, it's very difficult for me to pinpoint and go into the details, but research is ongoing today in those areas. How can we deliver an RNA in the cytoplasm and get therapeutic action, whether it is upregulation of proteins or down regulation of proteins? How can we deliver DNA? DNA is a double-stranded plasmid. Plasmid could be plasmid form or linear form. People use electroporation. Electroporation is, I know it's a high voltage electric current, really,
Right.
really high voltage.
Right.
People, that's how today DNA is being delivered. A high voltage electric current literally sends it across the
Pushed
skin.
over.
So it is, uh, we are trying to do is use of nanomedicine to deliver DNA and also deliver RNA into the two respective compartments. And
Right.
there's also another idea called CRISPR. CRISPR is essentially gene repair, right? So what you need there is you need a guide RNA and something called Cas. People normally use Cas9. is a CRISPR-associated protein. So you
Mm-hmm.
need to deliver two components in CRISPR case. So you need to have a protein that's going to go and fix your stuff
Okay.
wherever the gene is broken. This CRISPR is going to go. So the guide RNA takes you there and it does a repair action and come out. So it's much more complications than we're talking about. But this is the future. I'm pretty sure that in the next 10 years, we will be seeing medications coming out of RNA-based medication, nucleic acid-based
Nucleic
medications.
acid.
In short, I can say that there's so much of research going on in the US, different companies, pharma companies, where they're looking into. So if you look at the industry, in the last 50 years, most of the molecules were small molecules, whether it's like the acetaminophen or the paracetamol molecule, and they're all small molecules packed in a little pill. You take it, and then you get the efficacy. Then we moved to peptides like insulin and stuff like that, slightly bigger. Then we moved to big, huge molecules like Humira, right, for uh, arthritis and rheumatoid arthritis and other things. You need to have this large molecule so that people don't have to take frequent injections once in 8 weeks. These are like huge antibodies. They're huge proteins. Now we're still all these modalities are still there, but we're moving into the regime of nucleic acid therapies. It's a brand new topic, especially the amount of funding that I'm seeing in the last 2 years. Once the COVID vaccine is successful, number of technology companies arising out of this, creating novel nanoparticles that can deliver these modalities, right? Getting to the site of action. How do you really tune in? How do you mitigate the tox? How can we really track? There is tremendous amount. This is really going to be the future.
That's
So
amazing. That's great. It's exciting. I mean, if someone like me, it's really exciting that we will be eradicate a lot of diseases we have today as humanity, and we will be living healthier. I know we are all living longer nowadays, but are we living healthier? And that's a big question. So changing the topic a little bit, because we both are from material science background. I did masters in applied mechanics too, and you did it too. And we briefly talked about material. Now,
yeah,
we are fixing people. Like fixing means like we change the bone, we change the things, we change the hips, we change every single joint in the body pretty much can be replaced, except I think in our brain. So, but I haven't seen a material which is just like our bone. What is really the challenge? Because we are replacing our bone with the different kind of material, like which is much harder and very different than our bone.
I think biomineralization is a topic that is very well studied, right? Alternates of calcium phosphate.
Mhm.
And look up this institute. It's part of Harvard in Cambridge, Massachusetts.
Okay.
This institute, WYSS. This institute have artificially tried to grow tooth and bones outside of the body. So I think it's again the question is you can grow them, uh, but basically it's bioinorganic material, right? You have to grow inside the body. That's the problem, right? How do you
Okay.
really control? I mean,
Keep it
you,
for
you don't
six
want to
months, 9 months for growing it. Yeah.
yeah, you don't want to grow outside and go an invasive procedure to fix it. And we already have titanium and, like you said, beautiful metals to do the job.
Right.
Um,
Yeah, but the problem
and
with those metals is like you change, you completely deform the body because it's not the same. So our body reacts very differently. And most of the time, I heard like after a few years, 5 year, 10 year, people the joint start failing or start creating another problem because on one side of your body you have this titanium, on other side of the body you have real bone. So now
yeah,
not equal, right? You have different kind of strength. And on, I mean, on a funny note, like we talk about bionic man, where people are saying am I going to go for a optional amputees and I will get these gears so I can jump faster, I can run faster. It's fascinating word. So where do you see that word is going? Do you see people are going to go and get these prosthetics to get better in the life or do interesting things? What is your take
I
on?
think, yeah, I think it all depends. We have to do all our work with full ethics, right? Curing a disease and taking care of unmet medical needs is one thing.
Mhm.
But I'm sure there are other means to. We have regulations, right? Pharma industry is one of the highly most regulated industry that I ever know of, more than the financial industry or the other tech industry, because we are doing everything for humans. So um, I'm sure there's a benefit risk factor associated with getting prosthetics for lifestyle improvement. Even within the FDA, there's class of lifestyle improvement versus life threatening, right? If you say, yeah, for example, hair growth versus like alopecia versus something else, heart valve heart valve replacement, that's clearly lifestyle versus yeah.
Yeah,
So
different problem.
yeah, it's very different. So
But the
again,
huge industry, hair growth is a big industry, man. Let's not ignore
yes,
that.
yes.
Hey,
Yeah.
Anand, I can talk to you for hours, and you and me have so much interest in so many crazy things. And I mean, I love chatting with you. Probably, I will say this is one of my best, most informative session I had, and a fireside chat we had.
Thank you.
So before I
I'm
let
really
you go,
honored.
I know you have to run. I have two very simple questions, which is very easy. Number one question is, you are a material scientist, you are running the research. So what role curiosity has played in your life?
Well, curiosity really drives a lot of things. Just to understand, for instance, the example I gave you, the path of least resistance the particle takes and go to that little area versus where you want to go, that's curiosity, right? How do you change the biodistribution of that particle? What
Yeah.
can I do to change that? That's a big curiosity aspect, right? Because these are mostly black and white. Some of the biology process you can't understand, right? For instance, how do things come out of the cell? How do you preserve other tissues? But things like material science principles like TEM and other technologies, imagings can help you understand the biodistribution. So that's curiosity is always something very helpful for scientists. In fact, if you're not a dreamer, if you're not curious, you're just a pair of hands, right? And these days, automation takes care of most of those. But I'm fortunately surrounded by a team of people who are extremely smart, and curiosity has a big role to play.
Cool. That's awesome. No, it's fascinating. Almost every single friend of mine I brought on this show is talks about that he believes if he has to pick one single word to define their life and why they are here, curiosity is definitely in the top five words in his life. I don't know, or their life actually. I don't know how much role it has played. In personally my life, curiosity is number one. That's why even I have T-shirt made for myself, amplified
Oh,
curiosity.
that's right.
Always
Great.
looking
Yeah.
for ways how I can amplify my curiosity.
Yeah,
Um,
no, absolutely. It's a great thing to mention. And we didn't talk about some areas like delivering molecules to the lungs.
yeah.
In material science, people have created floating particles so that it doesn't get
Wow.
trapped when you inhale them. It doesn't get trapped. If it is heavy, they condense, right? If they're light, they go to where they want to go in the lungs. So these are beautiful. It's all based on out of curiosity of people. But I also want to close out saying that I'm really indebted and thanks to faculty back home, my colleagues at IIT, researchers who helped me advance my curiosity during my thesis work. I'm really thankful to all of them, and especially the schools that we went through to do what I'm able to do today. I'm very fortunate to be doing what I'm able to do today.
Anand, I learn a lot in today's conversation, and especially for our friends out there globally. We have almost 500,000 alumni today. The numbers keeps varying. I'm not sure how many, but this is quite a large number we have. More than 100,000 students studying today in various IITs, 26 plus IITs, or almost of that number. So it's fascinating the work they are doing. And for all of you, I will tell you just one thing. Curiosity is the reason why Anand is here. Curiosity is one of the biggest reason I am here. I'm able to talk to you. I can't even think or fathom that thought 25, 30 years ago, sitting in IIT, just like you, studying, and be here and presenting to you how our world will be 2050 and beyond. We just saw a glimpse of our world with the eyes of Anand, that how nanoparticles, how nanomedicine is transforming our world. And I believe we are just starting. It's just the beginning. The opportunities are amazing, plethora of opportunities for all of us. We just have to dream big. We just have to start dreaming. We have to start solving these problems. Especially, I'm so excited about the patch. I know Anand is going to say, Sanjeev, you are in marketing or you're in sales. But the fact is, I do see a phenomenal opportunity if we can find ways to induce drugs or provide drugs to people without oral or without injectable. It's a tremendous value. Imagine if even the vaccine of COVID can be given by a patch. You change. I mean, I don't need to go anywhere. I have the patch, I put the patch, and I move on. I mean, just imagine if we can start working on these kind of problems. I know today it seems difficult, but 25 years ago, we had no idea how we even solve the problems of COVID. Once again, thank you so much, Anand. Really appreciate your time. I'm so excited, and I'm looking forward for our next call.
Thanks, Sanjeev. Really appreciate your very eloquent and articulated it very nicely. I think there's tons of opportunities. So thank you for inviting me, and my hi to all the folks out there. And hopefully we can connect soon again. Thank you.
Thank you, Anand.